Brainly Beyond introduces you to 12 vitamin D deficiency symptoms. Vitamin D is a critical substance with far-reaching effects throughout the body. Despite its importance, many people do not appear to get enough of it. In fact, over 40% of American adults, as well as over 1 billion people, are connected to the internet. Vitamin D deficiency is a widespread problem. What gives? Vitamin D is only found in a few foods, and the majority of it is created by your skin. It's sometimes termed the sunshine since it reacts to UV light from the sun. Another cause for vitamin D shortage is that it's not always easy to spot. It's difficult to tell if certain symptoms are caused by low vitamin D levels. Perhaps something else entirely. If you're not sure if you're getting enough vitamin D, look for the following indicators. Number 1. Muscle pain. Vitamin D is essential for maintaining muscle function. Vitamin D reaches your muscles after being digested and ensures normal muscular contraction. This is also necessary for muscle strength development. If you're having muscle soreness that isn't related to exercise, it could be due to a deficiency of vitamin D. In fact, studies have shown that chronic vitamin D insufficiency is a common cause of muscle pain that does not respond to treatment. Number 2. Aching bones. Once you reach maturity, your bones stop growing, although old bone tissue is constantly replaced. New tissue has taken its place. Vitamin D is necessary for bone tissue repair, and a severe deficit can be fatal and cause bone softening. Osteomalacia, often known as adult rickets, is a disorder that can progress to osteoporosis. Because muscle and bone pain are commonly confused, it's crucial to understand how to distinguish between the two. Distinguish one from the other. Muscle discomfort is frequently focused in one area and is exacerbated by physical activity. Aching bones, on the other hand, are frequently experienced as a deep and widespread discomfort. Fatigue is number 3. We prefer to assign exhaustion to a variety of causes. Thus, this symptom is frequently disregarded. Several factors, however, your body requires vitamin D to produce energy, and a deficiency can make you feel tired. Throughout the day, I was fatigued and sluggish. This lack of energy can also lead to you engaging in harmful habit and negative impact on your health. So pay attention to your body. If you're feeling sluggish and can't figure out why, you could just need some rest. To increase my vitamin D intake. Reduced endurance comes at number 4. If you are physically active yet your endurance is deteriorating for no obvious reason, low vitamin D levels could be the culprit. Vitamin D, as I said previously, is critical for maintaining and enhancing bone health. This is especially true for endurance athletes. Even if they are getting enough exercise, physically active adults can experience lower endurance. Every day, there is ample sunlight. Fortunately, if this vitamin deficit is the cause, your endurance will improve soon. Normal low moods comes at number 5. Vitamin D is crucial, not just for brain function, but also for bone health. Vitamin D receptors can be found in areas of the brain linked to mood. As a result, low vitamin D levels can have a substantial impact on your brain cells. While more research is needed, there is evidence to suggest that vitamin D can help. Monoamines, which are neurotransmitters in the brain, are increased. Serotonin and dopamine, for example, are feel-good chemicals. A lack of these substances in your brain might make you feel down, even depressed. This is also why many people suffer from seasonal affective disorder in the winter. Affective disorder, which is exacerbated by the lack of sunlight throughout the winter months. Number 6. Sleeping disorders. Vitamin D has been discovered to play a part in getting a good night's sleep. The exact association between sleep and vitamin D is yet unknown, but research is being conducted. Vitamin D levels appear to be linked to the quality of your sleep. The vitamin D receptors in the brain may play a role in this relationship. Insufficiently supplied receptors perform less efficiently than they should. As a result, sleep quality may suffer. Number 7. Sweaty head. You perspire when your body temperature rises above 98.6 degrees Fahrenheit, 37 degrees Celsius. Help bring your body temperature down. This is typically quite natural. Perspiration also helps to remove toxins that build up in fat cells beneath the skin. If your head is sweating but the rest of your body isn't, it could be a sign of something more serious, that you might be deficient in vitamin D. Number 8. Hair loss. Vitamin D promotes hair follicle development. Hair follicles retain hair volume when they are healthy. Hair loss is, of course, a natural part of growing older. A deficit in vitamin D, on the other hand, might cause hair loss. This is particularly true for females. Low vitamin D levels have also been linked to alopecia. According to research, is an autoimmune disorder that causes bald spots on the body. Number 9. Wounds take time to heal. If you get hurt and your wounds take a long time to heal, it could be due to a vitamin D deficiency level in your body, could be to blame. Vitamin D is essential for skin regeneration, so if you don't get enough, recovery will be hampered. This is especially problematic following surgery and might lead to more intense symptoms. Dizziness is number 10. Vitamin D is essential for the correct functioning of your ears. Vitamin D receptors have been discovered in calcium channel trafficking. According to research, you may experience sudden hearing loss if calcium crystals in your inner ear become dislodged, nausea, dizziness, or a spinning sensation. Among other unpleasant symptoms, this is known as benign paroxysmal positional vertigo, and there is plenty of evidence that it exists. It's been linked to a lack of vitamin D. Number 11. Heart issues. Vitamin D insufficiency is perhaps one of the most underappreciated risk factors for heart disease. However, accumulating data suggests that insufficient levels of it can have catastrophic consequences, such as increasing the risk of heart disease. There appears to be a link with high blood pressure as well. Low vitamin D levels, according to several large research studies, can double the risk of cancer and risk of a stroke, heart attack, or other cardiac problems. Number 12. Excessive body weight. Vitamin D is thought to help your body absorb vital elements like calcium and iron. Calcium, for example, is necessary not only for bone health, but also for a healthy metabolism. Obesity, according to research, increases the body's need for the vitamin. Furthermore, persons with wider waistlines have a harder time converting vitamin D into a usable form, shape, and may require up to 3 times as much as those of medium weight. Maintain normal levels. Number 13. Recurrent infections. Vitamin D levels have a direct impact on your immune system's health. Your immune system stays strong and healthy when your body can process enough of it and is capable of fighting infections and illnesses as intended. Getting too little of this important vitamin might have catastrophic implications. It can severely compromise your immune system, leaving you exposed to recurrent infections and long-term illnesses. Number 14. Reduced cognitive function. The physiologically active form of vitamin D has been proven to have neuroprotective properties. This indicates that the vitamin aids in the preservation of nerve function. It is critical for your brain to function properly. A shortage of this vitamin, according to research, is a significant role in diminished mental capacity. In fact, there is strong evidence that low vitamin D levels are linked to dementia. Alzheimer's disease, for example. Adults with severe vitamin D deficiency are 4 times more likely to get cancer. Suffer from cognitive impairment. While vitamin D insufficiency is a worldwide problem, there are few things that can make it worse, resulting in an increased risk of low vitamin D levels. When you are exposed to sunlight, your body creates vitamin D. This means that if you spend too much time indoors, you risk having low levels, at home or at work, dwell in the extreme northern or southern latitudes, or overdress. Because of the increased quantities of melanin in darker skin, it naturally produces less vitamin D. Their skin is designed to shield them from excessive UV exposure. However, if you think you could be deficient in vitamin D, you should be tested. Check your blood sugar levels. The good news is that most vitamin D deficiencies are simple to correct. You can increase your vitamin D intake by getting more sun exposure and eating more vitamin D-rich foods. Take a supplement or eat fatty fish or fortified meals like porridge. It has the potential to improve your health. Give this video a thumbs up and share it with your friends if you found it useful. Subscribe for more videos like this, and don't forget to turn on the notification bell. Also, make sure to take a look at our other videos. Thanks for tuning in.